founded and produced by Professor Ahmed Mamdouh El Sharif, Professor of Epidemiology and Infectious Diseases of Animals, the ex-head of Department of Veterinary Medicine, the ex-Vice Dean of Faculty of Veterinary Medicine, Bani Suef University, Technical Veterinary Learning, TVL channel, Enterotoxaemia in ruminants, calf and lamb enterotoxaemia. Calf and lamb enterotoxaemia is a highly fatal infectious disease characterized by diarrhea and dysentery, hemorrhagic enteritis, ulceration of intestinal wall, and sudden death of all affected lambs or calves. Epidemiology of this disease. Number 1. Pathogenic risk factor is Clostridium perfringens type B toxin. Clostridium perfringens type B toxins have 4 more ones: alpha, beta, epsilon, and iota. Clostridium perfringens major toxins: the alpha toxin produced by nearly all strains and isolates, phospholipase, hemolytic, lethal in mice, thermonecrotic in guinea pigs, while beta toxin causes intestinal necrosis, diffuses from intestine to cause toxemia, and also cause lethal thermonecrotic. Epsilon toxin diffuses from intestine to cause central nervous system effects with lethal ends and thermonecrotic effect. Iota toxin have 2 components. A small causes ADP ribosylation of action, and P small mediates binding of internalization of A small. Minor toxins produced by Clostridium perfringens type P reach to more than 20 toxins. From them, we choose hemolysine, DNase, lysosinase, lipase, coagulinase, protease hyaluronidase, and neuraminidase toxins. Shape of Clostridium perfringens organisms. Clostridium perfringens organisms under microscope are gram-positive bacilli. Clostridium perfringens organisms showing beta homolysis on blood agar. Clostridium perfringens organisms reported worldwide in distribution, especially in heavy producing countries and exotic in Egypt. Animal and environmental risk factors. Clinical cases due to Clostridium perfringens toxins reach to 30% in lambs, while the case fatality is 100%. Outbreaks affect on lambs with 1 to 4 days old with very short clinical signs. Time of onset is during lambing season. Transmission. This mainly by ingestion of spores during suckling of contaminated mother udder. Sources of infection are contaminated pastures with fecal matter of different ruminants, feces of different ruminants, and dead carcasses. Pathogenesis. Clostridium perfringens type P spores ingested. Then, when there is anaerobic conditions, activation and proliferation of these organisms will occur. to produce different toxins. Alpha toxins cause hydrolysis of membranes to RPCs, WBCs, leukocytes, and endothelial cells and lead to death. Beta toxin cause increased capillarity and desquamation of intestinal wall with an ulceration of intestinal mucosa causing diarrhea, acidosis, and toxemia, and also this ended by death. Epsilon toxin activate both alpha and beta toxins. Clinical signs. Number 1, bare acute form. There is sudden death without any previous signs. Number 2, acute form. Animals showing loss of suckling drive, presence of brown and fluid fecal matter, severe abdominal pain, and this defecation accompanied by painful stroking and then ended by death. In zootic farms, showing older lambs with 3 weeks old well affected by this BIM form, chronic abdominal pain, reluctant to suckle their mothers, and usually they are dead. A picture of calf with enterotoxaemia with sunken eyes, recumbent, and go to death. Lamb with enterotoxaemia leaning against pipe as it cannot stand and try to support himself. A picture of lamb dead from enterotoxaemia. Post-mortem examination. Dehydrated carcasses, hemorrhagic enteritis, ulceration of the intestinal mucosa that reach to 2.5 centimeters, and rest of mucosa is dark red. Shape of intestines of lamb affected by lamb dysentery due to toxins of Clostridium perfringens type B. Hemorrhagic intestine in a case of lamb dysentery due to toxins of Clostridium perfringens type B. Subserous edema and congestion in intestine of calf infected by Clostridium perfringens type B toxins. Subserous edema and congestion of the intestine of a lamb post-death from Clostridium perfringens type B toxins. Hemorrhagic edema and emphysema in the intestine of lamb dead from Clostridium perfringens type B toxins. Laboratory diagnosis of Clostridium perfringens type B done by examination of the intestinal content smears to detect huge numbers of Clostridia organisms with gram-positive bacilli. Culture examination on blood agar to see the beta hemolysis, and then toxin identification in the animal inoculation test. Differential diagnosis of infectious diseases causing diarrhea in calves are colibacillosis, salmonellosis, viral infectious agent causing diarrhea in calves, calf enterotoxemia, cryptosporidiosis, and coccidiosis. For control of any disease, especially coccidiosis, both disease prevention first line vaccination is very effective. Keep on the track and still having the most modern and scientific knowledge about different infectious diseases of animals. Please subscribe the channel and you can get it all.